Good morning, good afternoon, good evening, everyone. Welcome to the second episode of the Public Health Gems podcast. Today, we are so excited to jump into our next episode. We're talking about Black Breastfeeding Week, and we're so excited to jump in. So before we go into our topic of focus, let's talk a little bit about what the Public Health Gems podcast is all about. We are looking at everything from a social determinants of health lens. So where we work, where we live, where we play, and then thinking about how that affects communities, how that affects our families. And today, as we think about breastfeeding and Black breastfeeding specifically, we're really just diving into issues that impact maternal health and also uplifting some of those really joyous stories, experiences, and what can our families and support people around us do to help to amplify Black voices in these spaces. So for this year, every year we have Black Breastfeeding Week. It is essentially, it's about the last week, and I know Nasheeda is going to correct me in a minute, but it's about the last week of August as we get ready and get down to the end of summer, right? And this year, the theme for Black Breastfeeding Week is We Outside, celebrating connection and community. So we're going to get into that theme with Nasheeda in a little bit. Our speaker, we have Nasheeda Pollard. She is in the MPH crew. So shout out to all of our MPHs like ourselves out there. She is also a internationally board certified lactation consultant. I had to look down at my notes for that, yo, okay? So internationally board certified lactation consultant. She is also a CLC, which is also in the lactation space. She's going to tell us more about that because I do not want to mess up everything in her title, but she's wonderful. She's phenomenal. I've had the opportunity to cross paths with her in work before as we worked in this maternal health space, and we'll get a little bit into that today. But let me stop rattling off and just say thank you, Nasheeda, for joining us today. I wish I had a little bit of some clapping sounds, but I'm not there yet. We just started out with this podcast. But insert your clapping sounds here. Nasheeda, thank you so much for joining us. As I mentioned 1,000 times already, we are excited to jump into this conversation and to get grounded. So as we're coming in for just some introduction points about you, I know that everybody wants to know, can you tell us more about your pathway in the space of public health, how that translates into maternal health in the lactation space, and also if you could just tell us about how you are a published author. We want to know about all three and how they combine all together. So I'm going to give you the floor. Thank you, Nasheeda, for being here.
Okay, well, thank you, Christine. As always, I'm so happy to see your face. And yes, so as you mentioned, I'm an internationally board certified lactation consultant, and I own a small business called Lactation Goddess, where I serve and provide lactation support both virtually and in person for those in the southern New Jersey as well as the Philadelphia area. In addition to many other things, I also work as a lactation consultant overnight at a hospital in New Jersey as well. So a lot of what I do now is really founded on some of the things that I've been doing over the years. It just kind of transpired into what it is now. But I do have a degree in public health. And during that time, I spent a lot of my focus on doing health education and providing education within the communities, all around Black maternal health. And because of all of the things that I've done over these years with just learning about the needs of our women and families of color, has then led me into this field of lactation. So I feel like everything has worked out the way that it was supposed to, in a way that I'm now able to support the people who are in need, as well as offering those services, because we know that lactation and breastfeeding can be very challenging for some. And there's so many myths and all the things that are out there about it, or even just some of the stigmas around the breastfeeding or the stereotypes that I'm sure we will really get to talk about. But a lot of the work, like I mentioned, when I've done the things within public health, has really helped me to kind of get to doing the things that I do now. And how that has transpired into me being a business owner. During that time, it was a lot of focus on like the community that I served and realizing there was a lot of needs that was not being met, specifically within lactation. So I created and wrote a book, a children's book to focus on that stuff, Magical Milk. So the idea was to help to bring representation within the field of lactation and understanding that people of colors, particularly Black and Brown families, do breastfeed, and we do breastfeed for extended periods of time, as well as just helping for children to begin to see it and normalize it from a young age. Because I don't remember or recall seeing anyone at that young age or until I was in college breastfeed. So that was really important to me to be able to help to kind of spread the word, to help to show that we matter in this field as far as like representation and seeing images of us in these books as well as other areas, which I do feel has been increasing. So I'm very excited for how that has taken off and look forward to whatever that is going to be in the future. But again, all of the things I feel like has led me to this is all because of that maternal child health like arena and being able to really focus on the things that I've seen over the years to be able to kind of support the families that I do now.
Thank you, Nasheeda. I think that first of all, I loved your introduction, and I'm just like sitting in, and I know a lot of parts that I know about, but some things you really just illuminated to me even. So I know our audience is going to be really excited about the work that you're doing. And I'm happy to say once again that that's how our paths crossed in that maternal health space, and even narrowing it down closer into the Black maternal health space and just all the different facets about protecting moms, as you said, how birthing people matter, and just everything that we do in those spaces and how it is so crucial and important. We want to hear more about your book, and I'll probably save it for the end, just thinking about the resources and about your business as well. But just thank you for the work that you do for moms, birthing people, and parents. It's so amazing. So for our next question, and we have to maybe take a couple of steps back because we know that some of our folks joining this podcast today, they're like, what the heck is breastfeeding? Okay, so everybody knows, imagery when you think about breastfeeding, what comes in your mind, but we know there's other options out there for breastfeeding and feeding and nourishing babies. So can you kind of define and give us like that definition of breastfeeding? And also tell us about some other feeding options out there for parents, because we know it's not as limited as some folks might think it is.
Yeah, I think when you hear the term just breastfeeding, you associate like a baby just at the breast, breastfeeding, if you will. But it's so much more than that now. And I think the biggest thing that has also changed within the field of lactation is the focus is just also the inclusive language and making sure that we're not just using the term breastfeeding anymore, but you may hear terms like body feeding or chest feeding or human milk feeding, and all of those are forms of, and breastfeeding is also included in that, ways people provide human milk to their babies. So that's essentially what breastfeeding is. And all those other terms fall within there as a way to be more inclusive, and including that every family does not look the same. Every family does not feed the same. And so to answer that question that you had as far as like the different ways that people may feed, there are definitely different options. So based off of even the inclusive terms that I just included, that people may choose to feed at the breast or chest directly. Some people may choose to exclusively pump their milk and feed it back to their babies. Some people do a combination of both breast or chest feeding as well as supplementation options with whether formula of their choice. And then there's also another form, which is called human donor milk. Sometimes that's not widely known, or I would say widely used, or even recognized in a way that people really know or even have access to. So that sometimes can be specifically for babies who are born early or premature, and may not necessarily, or some hospitals use that as a method of feeding to make sure that those babies who are at higher risk of certain things are getting their needs met, and also decreasing the chances of them having other illnesses or diseases that can sometimes be associated with formula supplementation if they're born before a certain gestational age.
Thank you for that, Nasheeda. And I think it's important how you laid out how we're talking about these little ones and babies. And how you just mentioned the emphasis on preterm births or early births, a baby that's born before 37 weeks, and of his or her their life, and just thinking about the best way to, nourish your baby is the best way. It's not just one straight narrow path, as Nasheeda mentioned. It could be a combination of different things as well. So whatever fits best, as long as we are nourishing the little ones out here.
And the other one that I didn't really talk about is also induced lactation. So, or relactating, which is methods that some people may use. For example, induced lactation could be the opportunity for your partner, if it's of the same sex, to be able to provide their milk to the baby as well. So, that is something that can be done. And parent with someone very specific who is very knowledgeable about how to do that. And then I said induced lactation is one method, and then the other method is of relactating for someone who may have started out breastfeeding and then for whatever reason stopped or stopped providing their milk to their baby and now want to resume that. They would then have to go through, either pumping very frequently to be able to provide their milk back to their babies. So again, as you see, there's a plethora of ways to do it. I think this is also where it's important too, if you're unsure or unfamiliar about all of these things, want to do your research, but then also be linked with or paired with someone who's in the lactation field to be able to get the support and the additional education that is needed.
See, and that's why I know that I picked the right name for this podcast, because you are dropping gems right now. You see me, those are that are on YouTube. You probably see me with my mouth open. I'm like, wow, I didn't even know about that type of feeding. So it's so important to, like Nasheeda said, have those support people, have your team or have a, support group. Those who, are in the lactation space that can, share what's working, and we know it's not a one size fits all approach for moms and birthing people, parents as well. So really appreciate it.
And
So
that goes back to what we were talking about with the public health and just overall, just that I feel like sometimes, and you can attest to this when working in certain areas and getting the funds or the grants or certain things, is always this like cookie cutter type of idea of being able to cut and paste and put it in these other communities and expecting it to work the same. So that's kind of how I look at lactation. Like everybody's needs are very different. And so being able to tap into that and understanding that even though within a community, even within the Black community, not everybody is the same, and making sure that you're doing whatever you can to adjust their individual needs to support them the way that they need to be supported, and not just this general idea of being able to provide that breastfeeding education or support.
absolutely. And I think that gets into a question that we have later down the line, but folks have been shamed, hearing that breast is best, and just kind of demystifying or taking away those stigmas. I mean, obviously breast milk, wonderful way to lactate and to feed your baby, but we know that there's many different ways in which and how and feeding. So important that we don't, like you said, the cookie cutter. It can't be a cookie cutter for
It cannot.
Yeah. So speaking of community, on our next question, I love to get to say this theme, so I'm going to play it out for like the next week as long as I can. But we know that the theme for Black Breastfeeding Week 2023 is We Outside.
Yes, we is. We outside. We outside.
We outside. We are outside celebrating connection and our communities. So can you share what breastfeeding and lactation, what that community connection means to you as a parent, as well as someone that is working directly in the lactation space? What does that all mean to you?
I think just overall that whole term of being like this we outside is just to, recognize and acknowledge the fact that there's so much out there. There are so many people who are out there doing the work, as well as just like celebrating being outside. Like it's just this whole vibe or feeling like, for so many years, depending on, all of the things that we're just coming out of with COVID, to be back in these spaces, back with people, celebrating and just like connecting with each other in another way, as well as just haven't done before or in a long time, communicating and connecting with people and organizations, to be able to continue to bring awareness around this wonderful thing, breastfeeding or chest feeding, body feeding, as we've just learned, to be able to just kind of, like I said, experience each other in person, because that's something that we still kind of been inching back into, if you kind of think of it on the grand scheme of things, as well as just the opportunity to just continue to uplift and acknowledge that we're out here, we're breastfeeding, we're having a good time, and then also educating in different areas that we don't always think about as it relates to breastfeeding. So giving people the understanding and education about how, if we're talking about it on this public health grand scheme of things, that how does that impact breast cancer or ovarian cancer? Or how does that, those stigmas about feeding and breastfeeding outside, So I know we're going to talk a little bit, maybe, or we can get into this a little bit more, but just the idea of being able to share and connect with people in different ways, that we want to continue to kind of push that and share that as the week begins.
Absolutely. Yeah. And the week is beginning, Black Breastfeeding Week. So we're really excited. I wish I had a shirt. I know, Nasheeda, you got a shirt on, you ready, you prepped. I need to find where I can get mine, but I'm going to work on that piece. But continuing to think about the awareness of it all. And you mentioned this really great point at the beginning. When we think about breastfeeding, chest feeding, body feeding, that there are myths, there are stigmas, stereotypes, misunderstandings around feeding babies. And so what can we do as public health practitioners, as even community members as well in these spaces? What can we do to kind of draw awareness to the truth around these messaging, and like to debunk some of these things, and then also to uplift and to celebrate even, some of these great, stories and advancements, and as you said, being outside with community?
I would say the biggest thing that you can continue to do is learn, and educate, like to do your own research, reading and looking up things. I feel that there's so much information that is out there on social media platforms. So some of it comes with some inaccurate information. So being able to learn within your field, or even if you're in the public health area, some of the key things as it relates to lactation, or even resharing accurate information or resources, because again, there's so much information out there. Some people who don't know, I'm not going to say everybody, but there are times where you believe what you see. So if someone is saying that they drink blue Gatorade and that has helped with their milk supply, then someone else may continue to go and buy blue Gatorade, or what's another one that I've heard? Oh, toughen up your nipples. You got to toughen up your nipples. No. So just being able to know and understand that there's certain things that are not correct or misinformation, and being able to decipher that and reshare or share the stuff that is accurate, as well as in addition to like learning on your own.
Look, when you said toughen up the nipples, I'm like, is that a thing? You saw my face? My eyes got so big. Yeah, so learning, like you said, knowing that information that is out there, that is the truth, that is the source, is so important. And when we do know, like you said, spreading that word too. So I imagine that there's toolkits available for Black Breastfeeding Week. There's like a lot of great information that we could find that is the truth. So we could spread that with our networks, and as I say, always our tribe.
Yes.
Our next question. So we're on Black Breastfeeding Week, but we know that also that August, the whole month of August, which is a beautiful celebration, it's Breastfeeding Awareness Month. So I don't want to say the theme, because I think I'm going to get it wrong, but I know that it's directly relating to the cross section between breastfeeding and going back to work. So how can we make breastfeeding work? How can we make feeding our children work, while we're in our working spaces? So can you share some tips on how lactating parents, how they can return to work and create safe spaces for themselves, And as a second, as we're on the public health side, are there any policies around that help to protect parents who need to pump or feed at work?
Yes, I agree that there's so many different things as it relates to being able to, and this is also an issue when we think about so many people and people of color who end up going back to work at earlier rates because they don't always have the benefit or the luxury of staying out for longer periods of time. So being able to be aware of the fact that there are laws in place to help to protect people who do decide that they want to pump at work. So the U.S. Department of Labor does have different resources as well as flyers that are available, but essentially is meant and geared towards birthing people who do plan on pumping or using a pump in their relative workspace. They have a right to a private place at their place of work to pump, as well as being able to be offered breaks. Now, depending on, and this is also important. So if you are out and you're planning to return back to work, having these questions or answering or getting these questions answered prior to you returning to work can help you to create like a plan. So that way, when you are there, you know where to go, what to expect. And then also having those lines of communication open of when you need to pump. So that way your employer is aware, as well as like it just sometimes create this peace of mind. So that way, you know, okay, if I'm able to pump at least 2 to 3 times within this time period, then I will be able to continue my breastfeeding journey or lactating journey. So that way I can continue to provide my milk to my baby.
Thank you for that. Parents, I hope that you are taking notes because once again, Nasheeda's dropping gems. Just giving me some really great information as well, that every mom birthing person has the right to a private space. That's major. So I'm glad that, you know, we're having this conversation, and to your point, Nasheeda, just having those conversations with your supervisor, your boss, letting them know, you know, about the
Yes.
requirements that if they're not aware, you know, making sure that they know.
Yes, and I was just about to say that. So if you were able to go on the U.S. Department of Labor's website, it has a lot of different information as well as like resources and handouts that could be provided and even share it with your provider. But I want to even take a step back because even with that and being able to feel comfortable enough to go to your supervisor or your manager or whomever your HR department at your place of work and feel comfortable enough to say, hey, I do need to take a break. Not everybody feels comfortable with that. And so how do you even address that? Like, I think that this is another area within public health where we can step in and be that advocate for those families who may not know or understand exactly how or where to do it. Giving them the resources or even talking with their employers about like, okay, if, for example, if you work within a health space or if you're in a physical location, and making sure they are aware for, you know, those who are like, are you aware for the other staff members, like health sector, who is really passionate about lactation and providing that additional support, helping to shed the light and maybe being that bridge between the employer and employee, so that way you're able to share that information and kind of connect and making sure that they don't have those fears or in fear of losing their job just because they said they needed a break.
That's where our policy and our advocacy folks come in, that we need these type of systems changes to happen where in our places of work. So while the policies are already enacted, you know, some of our employers might not be, you know, living them out or walking them through in our actual workplaces. So those advocates that you're mentioning, the policymakers making sure that it is felt throughout the whole organization or the whole department is needed. So it's not a secret that we brush under the rug. It's something that everybody knows about and has access to. So I love that. So we are getting to the end already. What? I can't believe our time is going by so quickly. Before you do leave us today, can you drop us with some lactation, some breastfeeding resources for the birthing people out there and families? And also, could you give us a reminder about your beautiful book and about your wonderful business?
So as far as resources, if you are local to the Philly, Jersey area, one in particular, and whom I'm also affiliated with, is BAE, which is Breastfeeding Awareness and Empowerment. They are focused on, and is a nonprofit in Philly that is really focused on helping to bring that level of awareness and education to people within the community. And they're having an event on Sunday. Um, Hence, we outside their annual barbecue. It's called BBQ for Bay. So that is one local resource. But I will say that on a national scale, there is BEMFA, which is Black Mothers Breastfeeding Association. There is ROSE, which is Reaching Our Sisters Everywhere. And so the U.S. Breastfeeding Committee, you can search on there to look up your local chapters of your breastfeeding coalition. And so there you have it. There's a lot of different resources and information that is available for you at your disposal to be able to learn more and to understand all of the different things that are happening within the field of lactation.
Thank you, Nasheeda, for that. It helps us to learn. It helps us to not be siloed in these spaces where we think we're by ourselves. There's so many out there that are having the conversation, not just for this week, but on and on. And so we're glad about that. And you mentioned BAE. I actually registered for that event, and our podcast is it's gonna air after the event. But for the people in the comments and everything, we have to chime in and say how it was. So Nasheeda, thank you so much for joining us today. I mentioned this a couple times during the podcast, but you certainly dropped some gems on us, opened up our mind on some things, and just as public health professionals, showed us what we can do around policy, around advocacy, how we can support Black moms, Black birthing people, and parents all together. And the information that you shared, as usual, in our past conversations and today, has been extremely valuable. Wonderful insight for our community of public health Johns out there. If folks want to connect with you, where should they connect you? Where do they find you in this internet world, in these internet streets? Let us know.
Yes. So you can follow me on Instagram at Lactation Goddess, as well as my website, lactationgoddess.com. If you are interested and want to learn more about the book, there's also a book trailer on my website that talks about the children's book that I've written called Magical Milk. That is also available for purchase on Amazon, as well as bulk orders for public health organizations who are interested. There is also a discount for bulk orders. But yeah, those are the ways to connect with me, reach out to me, and hopefully other ways could be even in person or connecting locally. So I can't wait to see you on Sunday.
So what we're going to do for all of our viewers and for those chiming in from Apple and Spotify and all the podcast places, we're going to put the resources and your contact information in the show notes. So do look for that. Thank you again, Nasheeda, for being here, dropping those gems on us per usual. Once again, we're here for the Public Health Gems podcast. We're just getting started. We got so much to go. During the summer, we've been doing about one podcast a month, like slowly creeping up. But when we get to the fall, baby, we're going to be here twice a month, every second and fourth Tuesday. So get ready for that. That is our first announcement of that. But look to hear more about some really wonderful, great speakers and just people that are doing it in the public health field. Do reach out to Nasheeda. Look out for Public Health Gems and Public Health John at publichealthjohn.com. And of course, on Instagram streets at Public Health John. We look forward to seeing you next time. Thank you, Nasheeda, for being here today. And happy Black Breastfeeding Week. Let's go. We are outside. Bye, everyone. Until next time.